What Zeke said from Steve Forbes and Carol Roth. Steve, what we just heard was essentially an explanation of what is possible, what could work, what should be working, but it's not working. People see that their health care coverage is getting less efficient, costing a lot more money, and insurers are leaving the states. I just wonder, all these architects of social welfare plans, whether it's for ObamaCare or something else, once they get down that road, their vision stays the same, but the reality becomes ever further apart from that vision.
Yeah, this is what happens when you have a top-down third-party system, David. It doesn't work because socialism doesn't work. If you have a normal market where consumers actually make the decisions instead of third parties like the government, insurance companies, big employers, insurance will work. Melissa was absolutely right. I don't need pregnancy services, but I'm forced to buy it. Young people under ObamaCare were grossly overcharged for insurance, so they walked away from it. You have a normal market where you can get catastrophic coverage. Guess what? Consumers put pressure, patients put pressure on providers like hospitals,
right.
And things like infections. Have hospitals post how many people die each month at a hospital from infections received after they're admitted to the hospital. Free enterprise would work if we allow it instead of this top-down VA-type Veterans Administration.
Well,
socialist
that's
system.
Carol. That's a prime example of what socialized medicine would look like in this country. But again, Zeke, Emanuel's solution to these problems is spend more money. You're going to need bigger pools if you have high-risk pools. It's all, once you get down that road, unless you're willing to go all the way to socialized medicine, and frankly, a lot of people in this country see how it works elsewhere and are not satisfied with the way it looks elsewhere, including me, and I spent a month in a British healthcare hospital, so I know what it's like. But it's always spending more money. That's the only answer they have for fixing things.
Yeah, not only spending more money, but putting the government in the middle of it. And not only do you have the VA example, but look at something like Social Security, where you do have young people paying in and understanding that that money is probably not going to be there for them later on. So it's the same kind of thing. You have another free markets person here. So I think that the free market needs to work on both the health care cost control side as well as buying the health care insurance side. If you have that transparency, so you know how much things cost,
right.
And you have that level of competition, both for purchasing the health care coverage as well as for receiving the services, that is the only way we're going to get the cost down and let enough people participate to make this work. And I'm not sure why especially the Republicans in Congress don't understand that.
Well, some do, and some are trying to get us away from more government control. But again, some are working us closer to government control. Steve and Carol, wish we had more time. Thank you very much. Melissa.
Thank you.